welcome to this. I think this is an important function we're having here today. I really want the media to publicize it. Many times we talk negative things. This is positive things. Let's talk about positive things also positively. We're here to really hand over equipment required for proper immunization coverage in the country. In our assessment, there are many programs in the Ministry of Health, but immunization seems to be doing very well. We have support from partners. We have a strong team in the ministry led by the minister and the deputy minister and the directors in the ministry. This is a program you should be proud of. Immunization coverage is very well in this country. We've not had an outbreak of measles in the last 20 years. We hear measles in neighboring countries, South Africa. We've not had an outbreak of polio for a long time. There are conditions that we now take for granted. When I grew up, when you go to schools, when you go to hospitals, you would see people in wheelchairs because they were crippled by polio. Now we are taking it for granted that I think some people have even forgotten what polio looks like. It's because we are vaccinating people. Immunization is one of the most cost-effective ways of dealing with health programs in this country. It's cheap. You don't wait for people to fall sick. You vaccinate people and they become immune to the problem of polio, measles. Rubella, we've just started vaccinating people. The media calls rubella measles. We don't have measles in this country. Rubella is another kind of measles, but it's not real measles. It's called German measles, but it's not rubella. It's not measles. We have rubella here in this country, and we are working to get rid of rubella also, and many other conditions that we are now vaccinating. I think this is something Zimbabwe should be proud of, and don't take it for granted. If you don't vaccinate, you will get sick. And I hear now people living behind tall walls around Harare, tall walls between the walls. They are beginning to take immunization as not important. When we launch vaccination program, they don't bring their children. The vaccines are here. They are free. You don't pay anything for the vaccines. And they are in a cold room in Harare, very strong cold room we have here. The vehicles we have here will now take the vaccines from Harare under cold conditions to the most distant places in Harare and in Zimbabwe. So let me refer to a memorandum of understanding between the Ministry of Health and WHO that we signed to purchase 33 vehicles that we are presenting to the ministry today. The vehicles were fully funded by Gavi, and Gavi is here. They approved a total of $1,696,200 to support immunization equipment and supplies. Already we have given to the ministry 73 computers, 73 laptops and associated equipment that have been distributed already, worth about $111,058. This already we gave out to the ministry in March.
You are watching ZimdiTv.
Today, the ministry will receive 24 land cruisers for use in districts in the country. The districts were not selected by WHO. The districts were selected by the ministry based on problems they have seen out there in the provinces. And the districts that are destined to receive vehicles, let me read their name because I was told, if you give the vehicles to Robert, some vehicles might remain in Harare. So I want the districts to listen and know that they have vehicles here. Pinge, Makoni district. Mutare district. Mbire, Rusinga, Samba, Chikomba, Goromodzi district. Seke, Makonde, Mondorongezi, Urungwe, Mashingo, Mwenezi, Shiva, Lupane District, Soloso District, Nkai, Gwanda, Matobo, Mangwe, Gokwe North, Gokwe South, and Berengwa District. Those are 24 districts that have received vehicles. As I said, we have also purchased 9 refrigerated trucks for taking vaccines to the district areas and also to the countryside. The total value of the 9 trucks is $701,000 US, 984. The 9 provinces to receive the trucks will include the headquarters, which is also looking after Harare province, Manicaland province, Mashonaland province, Mashonaland East, Mashonaland Central, Mashonaland West, Masingo province, Midlands, Matabeleland North, and Matabeleland South. The vehicles have all been labeled. Please don't take them and remove the label. I was told when the labels are on, people fear to drive them for private business. The vehicles should remain there with the labels. The labels include the label of the Ministry of Health, of Gavi, and also of WHO. Keep them there for our visibility. We also want to be known outside there that we've given something, not to headquarters only, but to the districts as well. Of course, we are going to proceed with registration of the vehicles and putting number plates. The number plate processes have just started today, and we should expect that they will all be fixed with number plates by the end of the week. So those of you who have come from the districts, when your number plate is ready, we will send you a message and you come and take your vehicles. They are not yet registered. So be patient with us. The vehicles just came last week. So we're just telling you about it today. Honorable Minister, we advise that the vehicles be insured before they go on the road. I think it's good practice. I hope you can take the responsibility to insure the vehicles. They are just trucks. They can. One day I invited your predecessor here and gave him a brand new Land Cruiser here, in front here. And the minister then got in the vehicle and drove it to that gate there and told his driver to now take over. And they went on that main road going to the ministry. The vehicle was knocked that very same day and written off the road. And it became very complicated because it was not yet insured and so on. So please insure these vehicles before you run them on the road. And tell your drivers to be careful. We don't want the vehicles to be written off before they do the work for which they are imported. So with these few remarks, I want to really congratulate Zimbabwe. The relationship you have with the partners that support you is very good. Gavi, UNICEF, and other partners, I think they're doing their part. The country is challenged, but for sure we are making our contribution to the health of the people of Zimbabwe. And I think if we continue this good relationship, we will overcome the challenges we face now. Thank you very much.
Kana muchida kuvewo kutanga kunzwa nyaya dzakadai mazuva ese, garai makateya pa YouTube nekuklika button rakanzi subscribe. Munobva maita wokutanga pa ZimdiTv News kunzwa zviri kuitika.
You are watching ZimdiTv.